The FDA has approved a second booster shot against COVID-19. Joining us now is Dr. Jeff Potoff, UW Health's Chief Quality Officer. Let's talk about this move from the FDA. Who can get the booster shot? When? They're not necessarily making it a recommendation, but they're saying you can if you want to, if you fit the time frame. So sort it out for us.
You bet. So right now there's two groups that are eligible for a second booster. The first was eligible weeks ago, and those are people who are, moderately or severely immunocompromised. So if that applies to you, not a bad idea to go out there and get that second booster. More recently now, like you're talking about, are individuals that are age 50 or older that are 4 months out or more from their last booster. And why this is important, really two reasons. One is the personal reason. We've got data out of Israel that suggests that if you get that second booster dose, your likelihood of severe disease from COVID goes down. So that's important. And then from the community standpoint, we're all enjoying not wearing masks, getting together, doing school like normal. All of us getting vaccinated and boosted on this schedule helps us survive the next COVID variant so that we don't have to go back to those things, keeps life normal for longer.
Well, let's talk boosters for a moment. Are people still getting them in terms of the numbers that you're seeing?
We still see people getting boosters, but vaccination in general has decreased. And I think a large part of that is because there doesn't seem to be that urgency. Cases are low, life has gone back to normal. And that's true. But, from the preventative standpoint, the idea that if BA.2, that subvariant, becomes more common, or if there's another variant that's on the horizon, if we all do our part now to get vaccinated and boosted, we won't struggle with the next variant like we have with Omicron.
That does make sense. But now, speaking of Omicron, if you've had COVID recently and you have that natural immunity and you are eligible to get maybe your first or even your second booster at this point, what do you say to those patients who have had it in the last 90 days, say? I mean, are they recommended to get the booster shot at this point?
Great question. And the simple answer is yes, get the booster. And the more in-depth answer is people who have had Omicron or COVID in general, some do develop a really good immune response, but some people don't develop a response at all. And it's really hard to know which one you are. So the best thing to do is if you've had COVID, once those symptoms resolve, go out and get boosted. We know that those individuals have the best protection of all of us.
Masks and vaccine mandates have pretty much totally been removed from everyday life. There is even more serious talk nowadays about them going away from airplanes. What are your feelings on that?
I think generally around the United States, case levels are low enough where masking no longer offers this significant benefit just because cases are so low in our communities. With international travel, it gets a little bit trickier just because the rest of the world is not necessarily enjoying the same reprieve from COVID that we are. And once you start mixing those passengers together, you could see transmission. I think as time goes on, we could look at loosening for domestic flights. And then if this continues to calm down, we could even see loosening on international flights.
All that being said, it looks like we're still headed in the right direction, right?
I feel optimistic, absolutely.
That's what we want to hear. Dr. Potoff, we appreciate you taking the time.
Thank you.